Everybody, welcome to the green room. So today I'm by myself. Dr. Barry Gordon's in Las Vegas having tremendous success winning. So today I'll be pretty much solo, but I have a special guest, Dr. David Berger, and I'll get into him in a minute. I just want to we start out with a little bit of politics and news and what's happening. So briefly, a quick shout out to the Tampa Bay Lightning for their successful win last night and bringing home the Stanley Cup back to back. So woohoo, go Bulls. Very, very good news there. We don't have a lot on the cannabis legislation side. It was pretty quiet last week, so I don't have a lot of updates as far as any legislation or things that were blocked anywhere or any news on any other states. So it's kind of a quiet week. So I know a lot of people have had a lot of questions about the topic we're going to have today, which is autism. And I have a very special guest. He's an amazing, amazing physician, pediatrics and holistic medicine. I met him personally probably a year and a half ago. I cannot give him enough accolades. Not only is he a wonderful physician, he's a great musician on the side, and he plays and sings a mean tune. So if you're ever lucky to hear him live and play in person, it's special. So I have the pleasure of introducing Dr. David Berger. So I'll have him give a brief introduction about himself because I just can't say enough. So Dr. David Berger, the floor is yours for an introduction.
Hi, thank you. Yeah, and I like to think of myself as singing happy tunes more than me. No, but yeah, it's so wonderful to be here. As some people know, Barry and I were really two of the very first warriors in the state of Florida for medical cannabis and the original legislation, and it's just been an amazing journey to be on with him through all of these years. My friend, my brother Barry. It's just I'm so excited to be with you today to be a part of this program.
Fantastic. So you have your own practice in the medical cannabis space along with pediatrics, and you do a lot with holistic approaches to children, obviously, and cannabis. And I know there's a lot of questions about the relationship between autism, pediatrics, what's considered okay. There's a lot of, I think, nervous parents, especially when they have autistic children. And so what are some of the things that you face when somebody comes to you and is looking for something alternative for their child and they're having issues and they think their child is autistic, perhaps not diagnosed? What do you do? Can you sort of walk us through the process from a holistic pediatric perspective?
Yeah, certainly. So first of all, most of the patients, probably 99% of the patients that I see who have autistic symptoms were patients who were diagnosed before they came to us in the first place. So, we kind of have been the group that's out there that's looking for root cause answers for a lot of chronic conditions. Autism was how I first got started. This was back in about 1998 with children with autism, and so the evaluations that we would be looking for: intestinal health, immunological health, looking at nutrients, making sure people have good vitamin D and zinc levels, making sure that there wasn't anything abnormal growing in their gut like candida or clostridia bacteria, how the levels of their good bacteria, the flora, is supposed to be in the gut, looking for food reactions, hormonal imbalances like thyroid issues, mitochondrial issues. So this was very much what I've been focusing my career on for the past 20 years. And as part of that, I started learning about herbs. And this actually happened back in 1996, 95, when an article came out in Contemporary Pediatrics called 7 Herbs Every Pediatrician Should Know About. Now, it wasn't about this herb back in 1998 that we were talking about, but it was written in Contemporary Pediatrics, which is the Academy of Pediatrics trade journal. Because of that, I was given permission to start using herbs in the pediatric clinic at Tampa General Hospital.
Wow.
And back then, that's when in the 90s we were already being taught not to use antibiotics for everything. Antibiotics are for bacteria. If somebody has a virus, don't put them on an antibiotic. And I started learning from my mentor, Dr. Lou Barnes, who is really kind of like the godfather of modern pediatric medicine. Besides being a huge advocate in breastfeeding medicine, He was also a very big believer in B vitamins and B vitamin metabolism and proper forms of B vitamins, etc. So I had this really great foundation in looking into natural and supplement driven medicine even before I got out of my residency. And so fast forward to a couple years later, then there were families with autism who started reading about how there may be certain herbs that'll be helpful for all the gut health, etc. Hey, would you run this stool test on my child to see if there is any yeast or bacteria there? Hey, would you check our vitamin D and zinc levels, which is such a part of my main practice right now, and yet nobody was doing that back then. But I figured, hey, these parents, they seem pretty smart. B, they have a child who they're desperate to help. Like, I mean, like, if you have it, especially back in, I mean, that's when, behavior therapy was just really starting to get more known, all the different types of speech and occupational therapy. In fact, autism was not very common back then, to the point where I think it was in like 96, where there was a child with autism admitted to the pediatric floor. And we were told, come introduce yourself, come see this kid with autism. You may never see one again. And
Oh,
obviously
and
that,
this is in the 90s. What, do you think it was just something that was misdiagnosed, or, or it just wasn't prevalent enough? Or, I mean, everybody's talking, there's a huge upswing, an uptick in the rates of autism. In fact, I was working with a company that was doing sending nurses, therapists, speech, occupational to the state of Hawaii school districts, because the state of Hawaii, 1 out of 4 children was diagnosed with autism. I mean, a huge number. And so is there just something that's in the water or in our food? I mean, this is like, it's actually very frightening.
yeah, well, I think that there are a couple things. I think that there are certainly kids who have a diagnosis of autism in this millennium who were labeled as mentally retarded back then. Obviously, that's
Okay.
became a kind of a word that people don't really use anymore.
Sure.
Obviously, if one breaks down what the word retarded means, it means slow. And so if there was a mental slowing, certainly, while it's not a term that we use, actually that is a fair description for a lot of people whose development was slowing. But so I believe that back then when I was in my residency, it was about 1 in 175 kids were 750, excuse me, kids were being diagnosed with autism back then. It's now about 1 in 60 nationwide that are being some people even say 1 in 50. So there was a tenfold plus increase in the diagnoses. Now, the real question is, why is this happening?
Exactly.
Okay.
Why?
And again, could it very well be that as time has gone forward, parents are now looking for help? These were kids who were being institutionalized. Parents were embarrassed to take their kids out of their homes back then. So I think that also some of it, because there is such more awareness about autism and acceptance about autism, that parents are now, very comfortable being out and about. I mean, so, certainly, I remember back then, I mean, within a few years, by the early 2000s, you couldn't walk through the mall without identifying somebody who was pretty
Autistic.
obviously have autism. And so again, were they coming out more? We don't know. But there has been also a lot of stuff that we have concerns about: the overuse of antibiotics, and what that's done to the gut health in terms of lowering the good flora that's supposed to be there,
Mhm.
and the allowance of some of those organisms like the yeast and the Clostridia bacteria that I mentioned, which are things that we test for. We do stool and urine testing to look for these things. Pesticides is something that we have a lot of concerns about. The plastics, we knew about BPA, now we know about other plastics. Hormone disruptors, things that, why are kids as a whole going through puberty earlier now? I mean, back when we were growing up, a typical age that a girl would get her period was between 12 to 14. Now it's between
Yeah.
10 to 12. So there are other things that are happening in the environment that we're exposed to. Quality of food sources, more processed foods, how we talk about trying to keep to the outside of supermarkets as opposed to down to the middle of the aisles, where more processed than foods that you can't have, that have ingredients that we can't even pronounce.
Yeah.
So the quality of that, the overworking of the land, that non-organic food, the quality, the amount of vitamins and mineral content within an apple or an orange compared to 30, 40 years ago, there's not as much nutrition in there. So I think that there's a combination of a lot of things that have kind of led us to where we are now.
I have a question. You had mentioned, like breast milk, and is there any link between mothers who breastfeed and autism? Like, is there any statistics that show that breastfeeding is healthier? I know there's a lot of benefits to breastfeeding, but in the results of autism later on, like for the moms that maybe don't breastfeed, so is that something that does anybody look at those numbers at all, or is
I
there any?
haven't seen it relative to actual autism, but in terms of IQ levels, there have been when all their variables have been taken into account, social, economic, and where they live in terms of regional, etc., that they have shown that kids who are breastfed do have IQ points that are approximately 4 points higher. And Dr. Barnes, who I mentioned before, his first mentee was Dr. Frank Oski, who literally wrote the modern today pediatric textbook. I mean, the one that we all use now. There's one called Nelson, one called Oski. And I was so fortunate to have him come to lecture when we were at Tampa General. I think this was 98 now. And he was giving the statistics where he was so, explaining how we are the only species that puts another mammal's milk into our body in the first place, as well as the only mammal who puts milk into our body once we've been weaned. And when he was presenting this information, when he pointed out that there was about a 4 IQ, and he said, I know 4 IQ points may not sound like a lot, but I sure wish I had that right now. So, so it was like so drilled in. So, but also just what we know in terms of infections and ear infections. If you get ear infections, you get an antibiotic. If you take an antibiotic, you can knock out the good flora. So I think that those are some of the paths. And a lot of what I do is connecting the dots. If A can cause B and B can cause C and C can cause D, how can you not say the possibility at least is there that A caused the D? So there's I think a lot more second to third generation, if you will, information. And so I like to use the term biologically plausible. Okay, that I can show you again if that domino effect happened, why at least medically it makes sense, biochemically it makes sense, anatomically it makes sense.
So when when a parent comes in, like you said, obviously the parents are, desperate for help and they're looking to you, to guide them. It sounds like you work a lot with the gut. So do you change the children's dietary habits? Do you look a lot at, nutrition, as you said, before you start like even a regimen for that child?
Absolutely. So, we are looking at what they're eating. It does seem as if for a large percentage of people with autism, that gluten, dairy, especially the protein in dairy called casein, as well as soy proteins, are really triggering a lot of the worst symptoms. There's actually evidence that some people don't fully digest those proteins. And so a partially digested protein gets formed that has the same chemical function and structure as opiates, which could explain behaviors, which can explain the disconnectedness, which could explain the GI issues, which can expect a whole bunch of other things. So that's for sure one of the things that we like to talk about. And then early on, again, the first appointment, I'm ordering vitamin D levels, I'm ordering zinc levels, I'm ordering iron levels, I'm ordering mitochondrial function tests, etc. So a lot, that's really kind of like what our first, for lack of a better term, our first fishing net that we throw out there to kind of see that's kind of, and then once we get those results back, we make corrections. And, thankfully, we do see a lot of clinical improvement when we do that. So then when cannabis came along, and I had started researching about CBD back in around 2012, 13, around there. And so this was before any Florida laws. This is before Florida made the proclamation that the only legal CBD was that which was sold by the dispensaries when the law came into place originally. So I had actually, for me, as I started learning about it, and even when the law came into play, I know most doctors who aren't familiar, using herbal medicine, because I use herbs in my practice all the time, I have for all these years. So I know that a lot of doctors took an approach of like, oh my God, what would we be giving this to kids to? What, how do I even do this? Why would I do this? And really were not comfortable at all. But for me, it was just another herb. And, because I had that experience for so long, and I'd been putting together individualized treatment plans for these children for so many years, that for me, it was like, to come together with how do you properly dose CBD, or how do you properly dose THC. It's not rocket science. You start off low, you give a few days to observe how things are going. You make I suggest making changes every 3 days, figuring maybe your kid had a good or bad day. So maybe over 3 days, you get a more of an average of what's going on. And you just make slow incremental dose increases. And if you're seeing something great, wonderful. If you're seeing something you don't like, you back down. You didn't break your kid. So for me, it was such a natural thing for me to go forward with this, that it was kind of like one of the biggest no-brainer, easiest decisions of my medical career.
That's amazing. I just wanted to say we have listeners that are across the country. So if anybody has any questions, you can go ahead and text us live and ask Dr. Berger any questions, because I'm sure there's a lot of parents listening today. So if you have any questions, we will take them live on the air. I wanted to ask you, is there any guidelines, or do you have set guidelines for at what age you have started any children with severe cases on medical cannabis? Is it, older children in their teens, or do you try to start them a little bit younger? What have you seen? Because I know you've seen a lot.
Right. So it appears to me that medical cannabis is a wonderful, wonderful treatment for symptom control, especially when talking about the high-powered medications, be it the Risperdal antipsychotic medications, which are the only medications that are actually FDA approved for a diagnosis of autism. Obviously, many of these kids may have hyperactivity as well, and so they get put on stimulant or non-stimulant medications. Many of these kids have anxiety, so they're put on SSRIs. A lot of these kids have sleep issues, so they're put on sleep medications. Just so happens that medical cannabis can take care of all of those things, and my experience is very well tolerated. You very rarely do you need to be changing doses once you figure it out, and changing products once you figure it out. Very rarely do people need to keep increasing doses in order to get the same effect. We tell them to take 2 days off to clear out those receptors if they are starting to see that some increased intolerance happening. So I don't really think that cannabis is getting to a root cause. But at the same time, there was a great study that happened, I think it was in 2018, that showed when they did blood levels of anandamide, which is one of the two endocannabinoids that our bodies all make besides the 2-AG, but that kids with autism had less circulating anandamide in their bloodstream compared to neurotypical children. So there is an endocannabinoid deficiency that is actually happening with some children with autism. Now, so obviously, similar to a person who has an insulin deficiency, they need to be taking insulin in order to control things. But why is the person insulin deficient? Why is the person anandamide deficient? That's what we don't know. But I don't look at, for a lot of these kids, as this. There's a difference for me for filling in a deficiency and covering something up. Okay, not that covering something up isn't potentially very important. There's if you hurt your foot and you can't walk and you feel, hey, until I get over this like bone bruise, if I take some ibuprofen, I'm okay covering up. I don't have a break. I'm not further damaging my tissues, my bones by doing this. Okay, I'll cover that up. But what do we know about cannabis is that relative to so many of the other medications that are out there, that it's very well tolerated. Especially for CBD. I mean, we're talking about the danger levels of vitamin C when we're talking about CBD. Of course, there is a question of very worthy conversation about what are the effects of THC on a developing brain. And we know that that's a thing. And we know that the brains are developing for really through 22 years or so. So, yes, there can be some bigger impacts on cognitive function and on other things when younger kids, teenagers especially, are exposed to THC. But we're also, informed consent comes down to the basic question: what is the potential benefit for this treatment compared to the risk, compared to the alternatives that are out there? Which is something that doesn't really get discussed as much. It's kind of implied, But to me, that's a really important question, because we know that putting, who are the kids that I see the most benefit with kids with autism? Violent, aggressive kids.
Oh, interesting. Okay.
Amazing improvements. Risperidol, an antipsychotic medicine, I've seen kids put 50 pounds on in a year using it. And there's a side effect, not as common as with older antipsychotics, called tardive dyskinesia, which is a movement disorder that can form from it. Sometimes it's not reversible. So again, when a family says, hey, I have an opportunity to do something that's, let's face it, whether you believe it's been around for thousands of years or millions of years, certainly has been around, the human experience with cannabis is certainly much longer than anything else that's offered in medicine, it would appear, maybe some Ayurvedic herbs over in India. But so, it's, again, if you have to say compared to what? Compared to doing nothing. Well, how's that working for you? Obviously, there, but when I have a kid who can be more controlled and more calm, so that they can sit through their school and they can make their way through their therapies because they're either not throwing things around the room, so distracted. That's another thing. Attention and focus issues, which most people would say, you're giving a kid pot for attention. Doesn't that make them, and focus, doesn't that make them less focused? Doesn't that make them less attentive, more in la la land? And I say to them, observe, see what happens.
See what happens. Sure.
I have so many kids who have come off of their Ritalins and Adderalls, who have come off of their Prozacs and Xanaxes, and who have come off of their Risperidols and Abilifies, using it, and they're doing better. So in that situation, of course, I always want to use the smallest amount of THC that we can get away with. Sure. I always suggest going into CBD first. CBD first. I always suggest when you bring in the THC, keep the CBD going, because we know that the CBD blunts the intoxicating effects of the THC. Find a happy medium. If you find you just send your kid into la la land, you know what? You didn't break your kid. Just don't do that again.
Right.
Call me. Let's talk about something. And so, something that you guys do, and thank you. And I thank you guys for sharing with us the idea, because as you know, we've modeled our office off of you guys, and the fact that we have a patient education room, and that every one of our new patients meets with our patient educators, that they have the opportunity to do so with every appointment, but also the fact that they can contact us between appointments, where I can do med management. We don't charge for those calls, those emails, but we're going to be available, just like if you were coming into my medical practice. If your kid's got a problem, I'm not going to say to you, you must come into my office in order to deal with it. I handle most things by telephone. I don't need to drag especially special needs kids in, or some of our cerebral palsy kids, or some of our seizure kids, which is why the taking away of the telehealth is just one of the more tragic situations that we've dealt with.
It is. I think it's an awful thing. And I really don't think some of these legislators realize, parents who have special needs children, if you have to haul in your child into an office, it's a traumatic experience, and to do that and not take into consideration the patient effects, I think is a tragedy, and I hope it gets revisited next session, because it is something that needs to be brought back. I did want to ask you, for results, because you do say that you do a lot of observation, obviously, of your patients. What are you seeing most beneficial? Is it a THC CBD ratio? Is it a certain ratio that works better? What are you seeing?
There is no one answer. Part of my individualized approach, where we do this titration, like I mentioned before, we ask families to keep a spreadsheet. What did you take or give? How much of it? And then we ask them to score their the symptoms on a scale of 1 to 5. 1 to 10 doesn't really matter. With 5 or 10 being the worst you've ever possibly seen it, or even a 0, which means that you're not seeing the symptom anymore. And I say, 5 minutes before you go to bed, just document this, recognizing sometimes more is not better. We know that microdosing, we know that patching can be a really helpful thing, especially if you're trying to make them through the whole day of school. To the, to whether, how are they sleeping, how are these things, because sometimes you're like, well, my kid was actually doing better 6 weeks ago. What were we doing? I've done some tinkering. If you wrote it down, you have a much better chance of figuring out, not having to go back to scratch. So it's such an individualized approach. And I view that what we do to give them both the confidence and the empowerment to recognize, let's face it, who knows a kid better? Am I going to know a kid better? Their parents going to know a kid better. Is the government going to know the kid better? Is the teacher going to know better? No, the parents are going to know.
Parents always.
Parents don't want to overdose their kids.
Oh,
They don't
God,
want to
no.
spend the money on it. My God, we know that this is expensive enough.
Mhm.
So, giving them the empowerment, the tools, what to look for. Part of our education under, going into deeper dives about not just what's a sativa versus an indica, but terpene profiles. Talking about some of the minor cannabinoids that we're now having more access to. How to find the actual product that may be best for you.
Sure.
Why is it that limonene terpene seems to have the best effect in terms of attention and focus for these kids?
Oh, that's interesting.
Yeah, it's so when I'm certainly there are some also, but I have found, and I counsel my families, always look for, it's pretty much always going to be in a sativa or sativa leading hybrid that you'll find the limonene, but like look for products that's listed as the top 3, if not the top 1.
Wow,
It's just an observation that I've been able to make over the past 5 years. And when I dug deeper, it seems as if that was one of the main terpenes, which was giving the sativa. And if you think about it, what is a sativa? The way I teach people, think sativa, stimulating, indica in the bed, right? So if it has a stimulating properties, what do we give kids traditionally for ADD? Stimulants. Yeah. So, there's other things that I do in my practice, like taurine, which is an amino acid. A lot of people have heard about it in Red Bulls. It's a stimulating amino acid. And, why is it that, it's kind of crazy in the first place. How does a stimulating thing calm kids down? Right. That seems like a paradoxical thing right there,
Yeah,
but yet it does. So I'm looking for stimulating terpenes because we know that THC itself can be a little bit more on the lowering side of things. So put the more calming, settling terpenes on top of that, and you may get a kid who's not functional. They're happy, they're calmer, they're not violent anymore, keeping families together. That's another one of the things that I've seen so beautifully, especially in my teenagers, not having to be put into group homes now, not having to be institutionalized, families who either been able to bring their kids home, where they were heading down the path of needing to find an institutional situation for their kid, who no longer are, keeping families together even in more than 50% of families with children with autism get divorced. The stress of it between the parents.
It's a huge stress.
And so you lower the stress level, you keep families together.
Keep the families together.
Yeah.
Wow, that's amazing. I wanted to, because I know we're coming into the last minute of our show, I just wanted to ask you just a brief question about, like, how do you feel about legalization? Do you think it would be beneficial to your patients or non-beneficial to, because I think especially with pediatrics, I really feel that medical has to stay here. Just because without like somebody like you, I know if you have children, I wouldn't want to just go out and start doing this or going to a dispensary and trying to figure it out on my own. You'd have to still go to a physician and somebody like you that has seen thousands of children. So I just wanted to get your perspective quickly on the thought of legalization and medical. Where do you see it?
Right. Well, we know that in pediatrics, even if there is legalization in the state of Florida, it's not going to be for kids under 18. Yeah. We know that. So there absolutely will always be, people with epilepsy, there's always going to be a need for medical cannabis. Yes. Okay. Now, the question will be, if there is legalization that happens in the state of Florida, how do they approach medical cannabis? Are they going to tax the recreational side to incentivize people in such a way to be under the care of a physician, which I think is important for anybody. I mean, for all of us, we're checking in with our patients at least every 7 months. Again, people like Barry and I who make ourselves available always to people. That's our thing. I really wish other doctors were out there. I mean, God bless the doctors who are just open enough to certify people. That would be great if they actually knew what they were doing, as opposed to saying go talk to the bud tender at the dispensary. But hey, are there people out there, let's face it, who have been using cannabis since they came back from Vietnam or from their days in the 60s and the 70s, or even more so who they figure it out? Okay. Does a vet who knows what they're doing necessarily need to be under the care of a physician if they've been doing it for the last 20 years? They know, listen, I know the strain I need. Listen, I know I need what I need to take. So could there be a role for recreational in our state? Of course. Let's face it. If alcohol is legal, if tobacco is legal, if Risperdal is legal, that it is a fair conversation to say, what are we doing here for adults? And so I understand that, but let's face it, and I know that you guys too, these 80-year-old and 90-year-old people who come in who like were so reefer madness anti-cannabis, especially when their kids, and they heard what their kids were doing and their grandkids were doing, and now they're all of a sudden like blogging about it. Themselves. I have a 92-year-old woman who blogs about her medical cannabis. She's and so God bless Mary. But so obviously, the world has changed. We know, how the acceptance of cannabis has certainly been overwhelming. That's changed over the last 10, 20 years, etc. So there's not a stigma about it like there was back in the day.
Absolutely. Dr. Berger, I would love for you to give a shout out to your practice. So if there's parents listening, how do they get in touch with your office?
Certainly. Well, fortunately, if you Google Dr. David Berger or cannabis or holistic medicine, you will find me. The name of our cannabis practice is Wholistic ReLeaf, holistic spelled with a W, so WHOLISTIC. We spell ReLeaf RELEAF. Thank you, Mo, for helping us name our practice to kind of play on the word leaf. My main practice again is holistic with a W, Wholistic Pediatrics and Family Care, with the website being holisticfamilycare.com.
And we also, just so that our listeners, we do have a lot of local listeners in Venice. Dr. David Berger is located in Tampa, so we're very blessed that we don't have a far drive if you want to take your children to go see Dr. David Berger. We are out of time. I have to give my props to Dr. David Berger. Thank you for joining me today. It was a pleasure, and also so informational as always. And keep doing what you're doing. You're such a warrior for cannabis and for pediatric cannabis, and you do a phenomenal job. And I can't thank you enough for everything that you've done for this industry.
Absolutely. And tell Barry I say hi, and then I hope he continues his winnings. That family seems to have a nice win streak going.
They have something going on. I want to touch him when he comes back because there's something definitely going on.
I need to love him a little bit,
I know. He actually won yesterday. He won $11,000 on a slot machine yesterday in Vegas. So he's doing really well. Only Barry. So we will have Dr.
Yeah, the world shines brightly on people who help.
Yes, I agree. So I have to say thank you again. And for our listeners, Dr. Barry will be joining me again next week. Everybody stay safe, dry, and have a great weekend, and see you next week. And thank you again, Dr. Berger.
Hi, it's so nice to see you again.